Lyme disease often begins with something so small it is easy to overlook: a tick bite. The tick may be no bigger than a sesame seed, and the bite itself usually does not feel dramatic. But in some regions, especially across the northern hemisphere, certain ticks can carry bacteria that enter the body while the tick feeds. Lyme disease is not spread by ordinary contact between people, and it is not caused by the tick itself. It is an infection caused by Borrelia bacteria, delivered through the bite of infected blood-feeding ticks. The reason Lyme disease matters is timing. When it is recognized early, it is usually treatable with antibiotics, and most people recover fully. When it is missed, the infection can spread and create symptoms involving the skin, joints, nerves, and sometimes the heart. The ticks most closely linked to Lyme disease belong to the genus Ixodes. These are often called black-legged ticks or deer ticks in some regions, although the exact species depends on geography. Their life cycle makes them especially effective at quietly picking up and passing along infection. Ticks feed on blood at different stages of life, often from small mammals, birds, deer, or humans if the opportunity appears. If a tick becomes infected with Borrelia bacteria during one feeding, it may pass the bacteria to another host later. Lyme infections are most common in spring and early summer because tick activity and human outdoor activity overlap. People garden, hike, camp, work outside, and walk through grass or leaf litter just as young ticks are actively seeking hosts. After an infected tick bite, the earliest and most recognizable sign is often a rash called erythema migrans, or EM. It usually appears at the site of the bite about a week later, although timing can vary. The rash expands outward over time, which is one reason it is medically important. Many people imagine Lyme disease only as a perfect bullseye pattern, but that is not always what it looks like. It may be evenly red, oval-shaped, or have a clearer center, and it is typically not itchy or painful. That lack of discomfort can make it easier to ignore. About 70 to 80% of infected people develop this rash, meaning a significant minority may not notice one at all. Early Lyme disease can also feel like a general viral illness, which is part of what makes it tricky. Fever, headache, tiredness, muscle aches, and a sense of being unwell can appear before a person connects the symptoms to a tick bite. Some people never saw the tick, because ticks can attach in hard-to-see places like the scalp, behind the knees, around the waist, under the arms, or in the groin area. A tiny tick can feed and detach without leaving an obvious clue. This is why recent outdoor exposure matters when symptoms appear. A summer fever after time in tick habitat is not automatically Lyme disease, but it is a reason to pay attention, especially if an expanding rash appears. If Lyme disease is not treated, the bacteria may spread beyond the original bite area. This does not happen the same way in every person, but the possible effects explain why early care is emphasized. Some people develop severe headaches with neck stiffness, suggesting irritation of the nervous system. Others may experience facial palsy, where one or both sides of the face lose movement, creating drooping or difficulty closing an eye. Joint pain can appear, and in some cases the heart's electrical system can be affected, causing palpitations or unusual heart rhythms. These symptoms can sound alarming because they are. Lyme disease is usually manageable, but untreated infection can become a body-wide problem rather than just a skin rash. Later Lyme disease may appear months or even years after the initial infection, especially when the early signs were missed or untreated. One of the classic late features is recurring joint pain and swelling, often affecting larger joints such as the knee. The swelling may come and go, which can confuse people into thinking the problem is an injury, overuse, or another form of arthritis. Some people may also develop shooting pains, numbness, or tingling in the arms or legs. These later symptoms are one reason clinicians ask about travel, outdoor exposure, and past rashes, not just current complaints. Lyme disease has stages, but real cases do not always follow a neat textbook timeline. Diagnosing Lyme disease is not based on one detail alone. Doctors consider the pattern of symptoms, the likelihood of tick exposure, the local risk of Lyme disease, and sometimes blood tests that look for antibodies against the bacteria. A clear erythema migrans rash in a person with likely exposure can be enough to strongly support the diagnosis, because early blood tests may not always be positive right away. Antibodies take time to develop, so testing too early can miss an infection. On the other hand, positive antibody tests must be interpreted carefully because they can reflect past exposure rather than current active disease. The best diagnosis is a combination of clinical judgment and appropriate testing, not guesswork from a single symptom. Treatment for Lyme disease usually involves antibiotics, and several standard options are effective. Doxycycline, amoxicillin, and cefuroxime are commonly used, depending on the person's age, pregnancy status, medical history, and the details of the illness. A typical treatment course lasts about 2 or 3 weeks. For most treated patients, recovery is complete, especially when treatment begins early. Antibiotics target the bacterial infection, reducing the chance that it spreads and lowering the risk of later complications. It is important that treatment decisions come from a qualified healthcare professional, because symptoms that resemble Lyme disease can have other causes, and antibiotic choice is not one size fits all. Some people continue to feel unwell after recommended antibiotic treatment. They may report fatigue, pain, or cognitive difficulties that persist beyond the initial infection period. This is commonly referred to as post-treatment Lyme disease syndrome, or PTLDS. The key point is that persistent symptoms are real and can be disruptive, even when standard treatment was given appropriately. What causes PTLDS is still an area of study, and it should not be treated as a simple extension of early infection without careful evaluation. Ongoing symptoms may need supportive care, symptom management, and assessment for other conditions. The most favorable outcomes are still associated with early detection and prompt treatment, before the infection has more time to affect multiple systems. Preventing Lyme disease starts with preventing tick bites. In tick-prone areas, protective clothing makes a real difference. Long sleeves, long pants, socks, and closed shoes create barriers, especially when walking through tall grass, brush, or wooded edges. Light-colored clothing can make ticks easier to spot before they attach. Insect repellents containing DEET or picaridin can reduce tick bites when used according to label directions. After outdoor activity, a careful tick check is one of the simplest habits with the biggest payoff. Showering and checking hidden areas of the body can help find ticks early. Pets can also bring ticks indoors, so checking dogs after walks is part of household prevention. The bigger public health picture is changing. As of 2026, proposed human vaccines for Lyme disease are in clinical trials, and one is up for regulatory approval, but no human vaccine is currently available. This is not the first time a Lyme vaccine has existed. A vaccine called Lyme was produced in the past, but it was discontinued in 2002 because demand was insufficient. Today, vaccine research continues, while several vaccines already exist to help prevent Lyme disease in dogs. Until a safe and available human vaccine is part of routine prevention, the main tools remain awareness, bite avoidance, tick checks, and rapid medical attention when suspicious symptoms appear. Lyme disease is common enough in many places to deserve respect, but it should not create panic. The practical message is balanced: know where ticks live, protect yourself during high-risk seasons, check your body after outdoor exposure, and take an expanding rash or unexplained summer flu-like illness seriously. If Lyme disease is diagnosed early, antibiotic treatment is usually effective, and most people recover. The danger comes from missing the signs, dismissing a rash because it does not hurt, or assuming a tick bite is harmless in a high-risk region. A tiny tick can start the process, but early recognition can stop it from becoming a much larger problem. If you found this helpful, please like this video and subscribe for more explainers.